By the late Middle Ages, I found that medical care was mainly divided among three different types of healers, and each one had a very different role. The first group was made up of university-educated physicians who spoke fluent Latin and spent years studying ancient medical theories. Most of their work involved giving advice instead of providing hands-on treatment. They would examine their patients, consult the movements of the stars, and try to restore balance to the four humors, which people believed controlled the body's health. It was rare for these physicians to perform physical procedures themselves because their authority came from books, scholarly knowledge, astrology, and medical theory. On the opposite end were the local healers and cunning folk who had never received a formal education but relied on practical knowledge passed down through generations. They offered herbal remedies, homemade treatments, and specialized skills like setting broken bones. Even without university training, these healers were usually the most available and affordable option for everyday people who couldn't reach or afford a physician. Sitting somewhere between those two groups were the barber-surgeons. People often looked at them as little more than glorified butchers because they dealt with the rough, bloody, and unpleasant side of medicine that others avoided. Besides cutting hair and shaving beards, they also pulled teeth, set broken bones, drained painful boils, and even amputated damaged limbs when there was no other choice. As time went on, surgery slowly earned recognition as a respected profession. Instead of learning through university lectures, aspiring surgeons gained their knowledge by serving apprenticeships where they developed practical, hands-on experience. One of the best-known surgeons of the era was a Frenchman named Henry de Mondeville, who served as the royal surgeon to Kings Philip IV and Louis X. In the year 1320, he completed an important surgical work called La Chirurgie, a treatise that recorded many of his medical observations and personal experiences. As I learned more about Henry's work, I came across several remarkable cases that showed just how resourceful medieval surgeons could be. One story involved a man whose knee had been pierced by an iron rod with enlarged ends, making it impossible to pull the rod back out the normal way. Since there were no specialized surgical tools available, Henry improvised by building a wooden support to hold the man's leg steady. Once everything was secured, he carefully used a heavy hammer to drive the rod all the way through, managing to remove it without shattering the kneecap. Henry's time serving in the military also gave him a great deal of experience treating soldiers wounded by arrows. He stressed that every surgeon needed to recognize exactly what kind of arrow they were dealing with, because different barbed arrowheads required different methods of removal. In one memorable case, an English arrow had become deeply embedded in a patient's forearm. To remove it safely, Henry first had to enlarge the wound before he could extract the arrowhead. He also cautioned surgeons about the dangers of wounds to the neck, especially when the jugular vein, the carotid artery, or the trachea had been damaged. Even if a patient could still speak and appeared stable, hidden internal bleeding could cause death the moment the weapon was pulled free. Because of that risk, Henry advised waiting to remove the object until the patient had received the last rites from a priest. He also believed it was important to keep frightened patients as calm as possible, recommending that they be given bread soaked in spiced wine while anyone who was panicking or causing distress should be escorted out of the room. Whenever gangrene could no longer be controlled, Henry believed that amputation was the patient's only real chance of surviving. He carefully described where a surgeon should remove a limb based on how far the infection had spread through the body. If the gangrene had already reached the thigh, though, there was very little hope, and surviving the operation was considered extremely unlikely. Henry also provided a detailed explanation of how the surgery itself should be carried out. Before the operation began, the limb was tightly tied both above and below the area being removed. This helped limit blood loss and reduce some of the sensation in the limb. While assistants held the patient as still as possible, the surgeon either separated the limb at the joint or sawed directly through the bone. To avoid unnecessary damage, the soft tissue was shielded with damp cloths, and the bone was cut using slow, steady, and controlled movements. What makes all of this even more incredible is that these operations were performed long before modern anesthesia existed. In most cases, patients had nothing more than alcohol or opiates to dull the pain, leaving them awake through an unimaginably painful procedure. By the late Middle Ages, amputations had become more common than ever because of constant warfare, serious accidents, widespread disease, and eventually gunshot wounds. The earliest firearms caused devastating injuries that medieval surgeons had almost no way of repairing. At the time, many doctors believed that gunpowder poisoned a wound, so they treated these injuries by pouring boiling oil into them. The pain was excruciating, but they believed the burning oil would destroy the supposed poison and give the patient a better chance of surviving. As I continued learning about medieval surgery, I discovered that surgeons had developed several different ways to perform amputations. One of the quickest methods was known as the mallet and wedge technique. During this procedure, the injured limb was placed on top of a wedge, and the surgeon brought down a heavy mallet to force the limb apart. While the operation could be completed very quickly, the tremendous impact often crushed the bone, leaving severe damage that made the wound much harder to heal. Another method took more time but generally produced much better results. This technique, known as the hands-width method, began with the surgeon carefully cutting through the soft tissue using a curved knife. At the same time, an assistant pulled the flesh upward to expose the bone underneath. Once the bone was fully visible, a bow frame saw was used to make a clean cut. After the bone had been removed, the soft tissue was carefully pulled back down over the end of the stump, creating a natural cushion that helped protect the remaining limb. Controlling blood loss was one of the greatest challenges during these operations. To stop severe bleeding, surgeons either sealed the blood vessels with red-hot irons or applied harsh corrosive chemicals directly to the wound. Both treatments caused tremendous pain, but they often meant the difference between life and death. Even with all of these hardships, some people who lost limbs managed to rebuild their lives by using early prosthetic devices. Around the year 1500, the Italian surgeon John Minadoy wrote about one patient who replaced a missing hand with a simple artificial limb. He also described another man who had lost both hands but learned to use iron prostheses so effectively that he could remove his hat, open a purse, and even sign his own name. As I read more of Henry de Mondeville's writings, I was surprised to learn that he also performed surgery on patients with severe head injuries. He even described cases where people survived despite losing large portions of their brain tissue. According to Henry, exposed brain matter looked like soft white cheese, and he wrote that it wasn't unusual for him to remove pieces of brain that were still attached to arrows after pulling them from wounded soldiers. I also discovered that one of the oldest surgical procedures ever practiced was trepanation, and it remained common throughout medieval Europe. This operation involved drilling an opening into the skull to relieve pressure caused by bleeding, swelling, or skull fractures, injuries that were especially common on the battlefield. To perform the procedure, surgeons drilled several small holes close together before removing a round section of the skull. This allowed them to expose the brain or release blood that had become trapped beneath the bone. Even though the operation sounds incredibly extreme by today's standards, archaeological discoveries show that many patients actually survived. Numerous excavated skulls display clear evidence that the bone healed after the surgery, proving that at least some people recovered successfully. What surprised me even more was that some medieval medical texts recommended trepanation as a treatment for epilepsy. At the time, physicians believed the condition was caused by harmful humors or trapped air inside the head, and they thought creating an opening in the skull would allow those substances to escape. Looking back at everything I learned, it's clear that medieval medicine had serious limitations. Doctors and surgeons didn't understand germs, infections, or human anatomy the way we do today. Even so, they came up with surprisingly practical ways to treat injuries they could actually see. Using only the simple tools they had available, they managed wounds, set broken bones, performed amputations, and treated severe head injuries with a level of ingenuity that still stands out. By modern standards, many of these operations were incredibly painful, extremely risky, and often failed to save the patient. Even so, surgeons like Henry de Mondeville helped lay the groundwork for the future of practical surgery. Through careful observation, hands-on experience, and a willingness to develop new techniques, they pushed medical knowledge forward despite the limitations of their time. After learning about their work, I can't help but see medieval medicine in a different light. It was far more capable, innovative, and resourceful than most people give it credit for.